Good morning, everyone, and welcome to this information session on the call for tender for the development of a rapid diagnostic medical device. My name is Agnès Mathieu Mendes, and I'm the head of unit in charge of procurement in HaDEA, the Health and Digital Executive Agency. HaDEA has a mandate to execute the funding program of the European Commission in various fields, such as research, health, food, industry, and space. Today's info session is devoted to a call for tender funded under the program EU4Health. Our goal is to improve the availability, accessibility, and affordability of innovative medical devices in the Union. The objective of this call is to develop an in vitro diagnostic medical device that can detect antimicrobial resistance to bacteria and possibly also to fungi causing infection in humans. This call for tender is implemented through a competitive procedure with negotiation and is composed of two steps. In the first step, we ask you to express your interest to participate. It requires the submission of documents proving that you are not in a situation of exclusion and also that you meet certain selection criteria. That, for example, you have a certain financial capacity and also an experience in conducting clinical trials. The deadline to submit your request to participate is the 12th of May at 4 p.m. In the second step, we will invite you to submit an offer, and only the candidates who successfully pass the step 1 will be invited to prepare a technical offer and a financial offer. So the second step will be launched probably around early June. You will have the period of June, July, and August to prepare these documents, and the evaluation of offers by HaDEA will start around September. My colleagues will now explain the following points on the agenda: the policy context, the scope and the technical characteristic of the diagnostic of interest, the step of the competitive procedure. They will go into further details, financial aspect, and intellectual property right. And now, without further ado, I will give the floor to my colleagues. Let's start with Raquel, working in DG HERA.
Hello, my name is Raquel Rodriguez Alonso, and I'm a policy officer at the AMR team in the European Commission Directorate Health Emergency Preparedness and Response Authority, DG HERA. I would like to just say a few words on the policy background of this call for tenders. HERA has identified antimicrobial resistance as one of the 3 priority healths to prepare against. AMR is a critical public health concern that causes more than 35,000 deaths per year in Europe. And if we do not act fast, predictions are suggesting that the death toll for AMR will increase to hundreds of thousands yearly deaths just in few decades. We see that diagnostics tools and antimicrobial susceptibility testing specifically can help us to enhance the patient treatments using antimicrobials more adequately and also support stewardship measures. Given this context and also the exciting technical innovation in the space of antimicrobial susceptibility testing technologies, we decided to develop this call for supporting R&D in this critical area. I would like to pass now the floor to my colleague Max, which will speak to you more about the technical aspect of this call for tenders. Thank you.
Thanks so much, Raquel. First of all, my name is Max. I'm also a policy officer in the same unit at HERA that Raquel works on, and I focus on innovation in diagnostic devices. I will just present a bit on the scope of this call for tenders and also the technical characteristics of the proposed product that we're looking for. So first of all, what are we looking to buy under this procurement, under this call for tenders? Essentially, there are 3 things. Most obviously to you, we want to support the research and development of a rapid point-of-care antimicrobial susceptibility testing device. Then there's 2 other points. Firstly, in special circumstances, which might be unlikely, but my colleagues will give further, my legal colleagues will give further context on this later. We, as the European Commission or contracting authority, might have access to some intellectual property rights. Then the third point is the priority right to purchase, which I'll discuss in a moment. Let's start with a few words on the technical objectives of this call for tenders. As you know, we're interested in antimicrobial susceptibility testing. And we are interested in a device that could focus on the bacteria and or the fungi causing an infection, syndromic infection in humans. And what we're really focused on and what we're interested in terms of innovation is the time to results, which is why we're targeting a time to results from subject sample collection within 1 hour. Note that this excludes handling and transport time. We realize that this is quite ambitious, but we really think that this is kind of a key innovation, and we want to push innovation in this attribute. The time to results of 1 to 2 hours could also be in scope, and we encourage you to apply even if your device under development is more in that time to results range. These aspects or attributes of the proposed device in your tenders will be evaluated against the what criteria, especially the innovation criteria, which I'll also say a few more words in a moment. And in general, what we're interested in is the antimicrobial susceptibility testing rules. This is kind of the primary thing. So meaning for a given syndromic infection, let's say a patient comes into a clinician's office and has a respiratory tract infection or a bloodstream infection or some other infection, the clinician can rapidly get the information which antimicrobials they can use and prescribe given the susceptibility profile of the pathogen causing the infection. And then additionally, what would be nice, but is not a must-have, let's say, under this call, is pathogen identification results. Of course, this is great. If additionally to the susceptibility results, you also get the information of what exactly is the causative pathogen. And as I said, this is more of an ideal, desirable attribute and not a must-have. Just briefly on the intellectual property rights. So by default, rest assured, like all intellectual property generated under this contract, usually remains with the contractor, and only in very special circumstances. Here, I urge you to look at the draft contract and also listen to what my legal colleagues say later, who know much more about this. Under special circumstances, like the contractor developing the proposed product, abandoning the development for any reason. It might be in the interest of the EU citizens and of course the taxpayers essentially funding this, the budget for this call for tenders, that some of the IP rights might be licensed to third parties, but again, more on this later. Then we come to the priority right to purchase. So this is one of the other things that we're buying or looking to buy under this contract, is that for the product that is to be developed under this call for tenders and then ensuing contract, the European Commission or the contracting authority could decide to buy a number of the devices and or the testing kits developed here and get priority access to these. So there could be, let's say, a hypothetical scenario where the AMR burden for a specific infection or a specific set of pathogens becomes really, really dire and a bad situation, and we decide with member states that there is an urgent need to procure a number of these types of susceptibility testing devices and the relevant kits. And so we put as an indicative number here 400 devices and 40,000 kits. As is important to know that these numbers are subject to negotiation, which you can find in the technical and the tender specifications. And of course, they also depend a bit on what exactly will be the device developed under this contract and what is realistic. In any case, to make use of this priority right to purchase, a separate procurement procedure and contract would have to be created in the future if this becomes relevant. My legal colleagues will also say a bit on this later. Then to give a brief sense of what kinds of devices could be eligible to be funded under this call for tenders. So here we're using the Horizon 2020 definitions of technology readiness levels, and kind of the products under development that would be in scope for this call is from TRL 3, which is proof of concept, until 8 until 8 system complete and qualified level, which is kind of validating that the device works in an operational environment and is kind of shortly before it comes to the market. So if you have a device under development that has at least TRL 3, you can probably apply to this call if it's within the scope of the technical device that we're looking for. And you should aim to reach at least 8 or 9 by the end of the contract, which means that it can be shortly before applying for conformity assessment and eventual CME marking to get on the market. But of course, if within the span of the 4-year contract you manage to even get CE marking, bring it on the market, then that's perfect, of course, as well. I know some of you might be more familiar with the framework of the 5 medical device development phases, but here we use the TRL definition. So just as an illustration and maybe to help you, I put this slide with a few more explanations. You can pause and have a look, or also look up this project name that I put at the bottom, where they created this TRL self-assessment tool just to get a better sense of where your product is at right now. A few words on minimum requirements and also desired product attributes. So these are specific words that are very important in the context of this call for tender. So yeah, this is really key. Minimum requirements, you will find this section in the tender specifications. And these are really pass or fail. So you need to meet these minimum requirements or you're kind of out and the offer is rejected. They're also non-negotiable, which is really important. So here I suggest you have a look at them and create a checklist for yourself. And then you also see exactly what are the minimum requirements. And there's a couple of points also on administrative compliance and so on, where we ask for things like an estimate or indicative unit price and so on. And here just put something, give an estimate, give a range. That this is to ensure that the evaluators for this call and evaluating the technical offers have all the information they need to understand really, okay, is this, how closely does this meet the award criteria and so on. Yeah, here you have the kind of things that are in the minimum requirements. So it's stuff like you need to provide evidence and demonstrate how your product really significantly kind of advances the state of the art, because of course we're not interested in funding the development of a device where a very similar product already exists on the market, because then we could also just go ahead and buy it. And it's things like, okay, you should provide a Gantt chart showing the timelines of when you expect to complete which tasks and subtasks in the development of the device. So those were the minimum requirements, and then we also have desired product attributes. This is table 1 on page 14 and 15, which is really crucial here. That essentially lays out a kind of miniature target product profile, which is based on a target product profile developed by WHO, and this table is intended to be ambitious. So all of the things here, the attributes of your proposed device are evaluated against the award criteria, taking into account these kind of ideal, desirable attributes of a device that we're looking for and looking to support. And they're intended to be ambitious. So we know that likely, maybe not all proposed tenders will be able to meet all of them, and some will be better or worse, I don't know. And then it depends on the points that you get awarded based on the award criteria. And you should aim to meet these desirable product attributes as closely as possible, but they are negotiable and they are expected to be met by the end of the 4-year contract. So that's kind of where we want you to move with your product under development. Then lastly, I'll just mention these award criteria, which I've spoken or alluded to a few times now. These you find on page 46, and it's kind of 5 categories, 5 criterions on which the evaluators for the proposals we will receive will kind of grade and give marks to the tenders to assess which one merits funding. And these are things like how innovative is the product that you're proposing, kind of based on the table we just discussed and the desirable product attributes, but also do you have the necessary expertise, kind of why will this product be really important to public health challenge and will have an impact on the EU and so on. And so this, I suggest you also read very closely and then maybe even consider structuring the tender along these 5 criteria when you send off the technical offer, because that makes it easier for the evaluators to kind of see, okay, here they address these points, and then we can maybe award these points based on the award criteria and so on. Okay, I hope that gives you a little sense. And now on to my colleague Chiara Giusto on how exactly the whole application process works.
Thank you. It's my turn to present you the structure of this competitive procedure with negotiation and give you some practical information about how to participate in this call. Before starting, my name is Chiara Giusto and I work in HaDEA, Unit A2, dealing with procurement under the EU4Health program. So this call for tenders is divided into 2 steps. We are now in step 1, and the step 1 was launched on March 24th, and it is open for submission of requests until the 12th of May at 4 p.m. So you can send also questions, always in writing, to the Funding and Tenders portal until the 5th of May. And we will reply you within 5 days maximum. Please note that to submit a request to participate, you need to prepare the documents that are listed in Annex 1A on page 56 of the tender specifications. Who may submit a request to participate? Well, this call for tenders is open on equal terms to all economic operators having access to HaDEA procurement. This means that all economic operators based in one of the 27 member states have access to HaDEA procurement. Whereas third countries, and you have some examples in the slide, they cannot submit a request to participate or a tender as main tenderer, but they can participate still as subcontractor when preparing a tender. So there is a list, as I said, of documents you need to prepare in advance and be submitted under step 1. There is the declaration on honor on exclusion and selection criteria. There is evidence that the person signing the documents is authorized representative of the entity, the agreement or power of attorney, and then you have to have a list of identified subcontractors if you are in 2 cases. For instance, if the individual share is more than 10% of the financial amount, or to fulfill selection criteria. For instance, if you rely on the technical capacity of a subcontractor to fulfill the technical and professional capacity. In that case, subcontractors need to be identified in an annex, and they need to submit a commitment letter that they want to engage in providing this evidence for the selection criteria, or if they have more than 10%. The selection criteria are, for instance, evidence of legal capacity. You need to provide information that you are authorized to perform the contract in your country of establishment, and the proof of compliance with the manufacturing processes for in vitro medical devices in the European Union. Or you can also send a self-declaration. What do we evaluate under step 1? First of all, it is important to say that step 1 is a pass or fail phase, which means that either you meet the requirements or you don't. So what do we verify? We verify restrictive measures, for instance, those sanctions that can be listed in Article 29 or Article 215 of the treaties. Then access to procurement, as I explained under EU4Health regulations. Administrative compliance, which means that the documents have to be submitted in one of the 24 of EU official languages, and the signature is the one of the authorized representative of the entity. The exclusion criteria is the filling in of the declaration on honor. And then there are 3 types of selection criteria: legal and regulatory capacity, economic and financial capacity, and technical and professional capacity. In the tender specification, and as you can see, we have put the sections or the page number where you can find these pieces of information. It is important to mention that under step 1, so until the 12th of May, you need to submit all evidence. So the supporting documents that will have to be submitted under step 1. What are the selection criteria? Legal and regulatory capacity. You are authorized to perform the contract in the country of the establishment. Proof of compliance with the manufacturing processes, as I said. And then there are the technical and professional capacity requirements. These are divided into 2 different criteria. A core team, for which you need to present the curricula of at least 1 senior manager, project manager, at least 2 diagnostic and testing solution specialists, and at least 1 healthcare researcher or regulatory affairs specialist for the core team. It is important to stress that experience in the IVDR regulation of the EU is an asset. The second criterion is the experience in the research and development of diagnostic medical devices. In this case, you need to present at least 1 past development of a diagnostic medical device covering the last 10 years preceding the tender submission deadline. For the economic and financial capacity, which are 3 criteria: average yearly sum of turnover, quick ratio, and ratio between total debt and equity, they will be explained later on by my colleague from the financial unit. After the evaluation of step 1 will be finalized, the contracting authority, which is the Health and Digital Executive Agency, HaDEA, will inform the candidates via email about the outcome of this evaluation. This piece of information will be most probably circulated around early June. So please provide a correct email address when submitting the request to participate and check it regularly. Participation to step 2 can only happen upon invitation by HaDEA. The procedure foresees to invite minimum 3 candidates who successfully passed step 1 to step 2, which entails the preparation of a technical offer and the financial offer. The deadline to submit an offer under step 2 is the 3rd of September at 4 p.m. The extension of this deadline is possible, but exceptional. While we can consider potential requests to extend this deadline, we also take into consideration the feasibility of these requests in accordance with the steps of the process. The documents to be submitted under step 2 are the technical offer and the financial offer. These documents are listed in Annex 1B on page 60 of the tender specifications. Please note that the technical tender should not be more than 70 pages, excluded annexes. Make sure that the text is legible, concise, it is clear, consistent, and adheres to the tender specifications. Offers, as you have heard, are evaluated against 5 award criteria, and so make sure that these aspects are all mirrored in your technical offer. After the evaluation of the offers is completed, the contracting authority will inform the tenderers about the outcome. Unsuccessful tenderers will receive a written communication in due time. HaDEA may decide to open negotiations with successful tenderers, and this phase may take place in September, October, for a maximum of 2 rounds of negotiation. HaDEA may also decide not to negotiate if one offer has reached the requested level of quality under the first submission. Reference to this right of the contracting authority is on page 39 of the tender specifications. The negotiations consist in providing a feedback to the technical tender to improve some aspects and to align with the tender specifications. Please note that not everything is subject to negotiations. For instance, the following elements are negotiable: the implementation plan, the priority rights to purchase, the quantity of diagnostic medical devices and the kits, the Article 1.8 of the contract, which is about the exploitation of the results of the contract. Whereas, on the contrary, what is non-negotiable is the following: the maximum amount of the contract, which is 12,860,000 euro. The maximum contract duration, which is 48 months. The minimum requirements and the criteria defined in the procurement documents. Please remember that this call for tenders will result in the signature of one contract only, which means that one tenderer will be awarded the contract. And now we can turn to the head of sector, Klara Kaznik, for the financial aspects of this call.
Hello, my name is Klara Kaznik. I am head of sector at the operational finance unit of HaDEA, and I will speak about the financial aspects of this tender. First, I would like to speak about the economic and financial capacity requirements that the tenderers need to meet. There are 3 criteria that the tenderer has to comply with. One, the first requirement is the average yearly turnover and also including other operating income that needs to have a minimum 1 million euro over 2 years of closed financial statements. The second criteria is a minimum level of liquidity in the form of the quick ratio. And the third minimum requirement is a minimum level of solvency. The average yearly turnover is considered for the whole group in case of several tenderers form a group and they apply together. The minimum level of liquidity and the minimum level of solvency is only required from one group member, again, in case there are several members forming a group and apply together. The other financial aspect that is important and relevant for the tenderers is the payment schedule, which sets out the frequency and expected amount of payments over the 4 years of duration of this tender. There will be 4 interim payments, first one with 10% and then the subsequent interim payments up to 20% each time, leaving 30% at the balance payment at the very end of the duration of this tender. There is no pre-financing payment, which means that there are requirements when we even make the first interim payment. Concerning the interim payments, the tender specification also sets out requirements in the form of a Gantt chart where you can present the breakdown of the financial efforts allocated to the major activities and milestones. As an annex to the tender specification, you will also find the template of the financial offer. Please note that this financial offer template may not be modified, and you need to use it as it is provided in the tender documents. You will be required to put the unit price for the elements and for the activities that you see, and which will come up to the total amount of the price. You may also indicate the tender validity period with compliance as it is set out in the in the contract notice. You can also indicate in the financial offer form your bank account that you would like to use in the service contract. Please note that when you define the unit prices for the activities that are set out in the template, you need to consider that the prices shall be all-inclusive. It should include all the costs, cost elements that you consider for the activities. It should be expressed in euros, and please do not use more than 2 decimals places, and it should be free of all charges, taxes, and also free of VAT.
Hello, my name is Petra Gerbotunova, and I am a legal manager in the Health and Digital Executive Agency, HaDEA, in Unit C2-4, which provides support to procurement procedures. I will present a slide on intellectual property stipulations and contractual obligations. The essential information is in Article 1.8 of the special conditions of the published draft contract for services. This article clarifies that the ownership of intellectual property generated within the contract performance, we call them also results, remain with the contractor. This is a derogation to general conditions of the contract, since in the procurement contracts of the European institutions, the ownership of results is generated by the contracting authority. The contractor will take all necessary measures to obtain IPR to the results, for instance, by applying for a patent, at least for all countries of the EU and EEA. There are some limitations. For example, HaDEA, as contracting authority, may require that the contractor grants a license to one or several third parties under fair and reasonable conditions in a situation when a triggering event occurs. Such event is, for example, when the contractor decides to abandon the development of clinical testing of the device. When the contractor decides to abandon the development or clinical testing of the device. When the contractor does not timely request the EC conformity declaration or is unable to obtain the conformity declaration. When the contractor ceases or is unable to ensure the marketing of the product in such a way as to respond timely and efficiently to market needs. Or in case of an urgent public interest, including EU public health emergency and EU security. The fair and reasonable conditions of the license will be determined according to the procedure described in the draft contract. This mechanism describes appointment of 3 experts with competency in IP and technology transfers, having no conflict of interest. The 3 appointed experts will take into consideration the opinions of the contractor, of the candidate licensee, and of HaDEA, also the conditions of the market, the public interest, and, if applicable, the health crisis situation and benchmarking exercise. And they will determine the fair and reasonable conditions of the license to be concluded. Also, HaDEA acquires ownership to submitted implementation reports and underlying data, and may use them for the modes of exploitation described in the draft contract, subject to the applicable rules on confidentiality. These are, for example, making available to the staff of the contracting authority and the Commission, distribution to the public, copying, reproducing in whole or in part. Last but not least, the Article 1.8 can be subject to negotiation if the negotiation takes place. During negotiation, equal treatment of all tenderers will be ensured. And now I give the floor back to Agnes.
So we have listened to an extensive presentation of this call for tender. Before concluding, I would like to remind you of some important points. Firstly, do not hesitate to pose your question in the Funding and Tender portal. This is possible until the 5th of May. Secondly, remember that the deadline to submit your request is the 12th of May at 4 p.m. and the deadline will not be extended. You should also prepare carefully the list of documents for step 1. You can find them in Annex 1A of the tender specification. We will inform you about the outcome of step 1 probably around the end of May, and only the successful candidates will be invited to the step 2. The deadline to submit a tender will be around the 3rd of September 2025, and if there is a negotiation, the negotiation will take place around September or October. So please also consult regularly the links which provide you with updated information on how to prepare this call for tender. I hope that this info session was very helpful to obtain more information, and I wish you good luck for the preparation of the procedures, and thank you very much for your attention.